When women are going through the change, or what we medically refer to as the perimenopause, that stage right before they totally quit having their menstrual periods, a lot of symptoms can occur. A lot of women sail through this and they really don't have a lot of problems. Their periods become further apart and lighter, and they really don't have a lot of hot flashes, so they really do well. A lot of women, though, have a lot of trouble. They may have heavy periods. They may have long periods. And with time, as their estrogen level goes down, they may start having what we call vasomotor symptoms, or commonly referred to as hot flashes or night sweats. And this is a lot of times what brings women in, either the heavy bleeding or the irregular bleeding or the hot flashes. And they're actually sometimes treated in different ways. The bleeding, we have many ways to treat it. If women are having heavy bleeding, totally irregular bleeding, they should notify their healthcare professional. The hot flashes can be quite disruptive. Not just a nuisance, but a major disruption of your life, because during the day you can just be sweating, soaking through your clothes. At night you're waking up, and when the hot flashes get severe, women should also seek therapy. There's all sorts of therapies for hot flashes. Sometimes we can try over-the-counter herbal therapies. There's some non-hormonal medications. But the best treatment that we have for these vasomotor symptoms or hot flashes or night sweats is actually hormone therapy. Today, in particular, women are concerned about the safety of being on hormone therapy, specifically estrogen, or if they have a uterus, estrogen plus progesterone. And they have a lot of questions, particularly since the Women's Health Initiative data was started to be released in around 2002, and we're continuing to get data from that study. But to make a long story short, it's all very individual as far as these risks and benefits go. For many women, the benefits of being on hormone therapy outweigh the rare risk. And what are the benefits to being on hormone therapy? First of all, it is the best treatment for hot flashes. Most women on hormone therapy will get a major reduction in their hot flashes. May not relieve them all, but it'll take care of most of them. In addition to that, the Women's Health Initiative showed that women on hormone therapy had less hip fractures. They also had less colon cancer if they were on the estrogen plus progestin arm. And women need to understand the seriousness of osteoporosis. There are millions of fractures in the United States every year, and a lot of them are hip fractures, which can be deadly or handicap one really for the rest of their life. Most women who break a hip will not regain their pre-fracture functioning. So these are important benefits. Now, what are the risks to being on hormone therapy? If you start hormone therapy right when you're going through the change, or within a couple of years of your last menstrual period, then the Women's Health Initiative showed there was no increased risk in heart disease and no increased risk in stroke. So what are the increased risks? Any woman on estrogen has a slight increased risk of having a blood clot in her leg, which could go to her lung. That's what we call venous thrombosis, which rarely could lead to a pulmonary embolus. That is very rare, particularly with today's low-dose therapy. And I need to add right now, that's really all we're using now. In the old days, they were using high-dose hormone therapy in women. And actually, even in the Women's Health Initiative, that was a pretty high dose. But today, most clinicians, and I know in my practice that's entirely what I use, is actually some very low-dose hormone therapy when I use it. So the odds of having a blood clot are really rare. Now, what women really worry about is breast cancer. Is being on hormone therapy going to increase your risk of breast cancer? And looking at the data from the Women's Health Initiative, they've shown that if you're on hormone therapy for many years, over 3 to 5 years, not 6 months or a year or two or whatever, but if you're on it for several years, there is this rare increased risk of breast cancer. And it looks like it's about less than one person it's less than one case per 1,000 women per year. But it looks like that risk is there with long-term use. And that's with the product that was used in the Women's Health Initiative that's higher dose than what we're using today. We don't have any data on using this ultra-low dose hormone therapy, but it's something that I tell patients that with long-term use, there's the potential that you're rarely increasing your risk of breast cancer. So you really have to put the risk versus the benefits. Now, there is some data that women who were started on hormone therapy early, right when they were going through the change, had a slight reduction in heart disease. But this isn't something we're prescribing to prevent heart disease. That's not an indication, and we can't say that now. But the good news is there was no increase in heart disease, and there's some evidence that some women actually got some cardio protection. So once again, you have to put the whole picture together. You can't just focus on breast cancer or colon cancer, whatever. You have to put the whole picture. For the individual woman, what are your risks and what are your benefits? And we have to put all that together. And for a lot of women, as they're going through the change who are miserable, the benefits outweigh the risk.